My name is Beth Nguyen. I'm a registered nurse. I'm also co-founder of Rare Strides, a founder of Rare Wish, and chair of the Georgia Rare Disease Advisory Council. So I heard about it through Maria Thacker Goff, the president. She was telling us that this event was going to take place, and it was very exciting. Also saw some social media posts. Events like this are extremely important because as a patient with a rare disease, I can share my voice and also share my experience to increase awareness and understanding among others that attend these events. I wear several hats in the rare disease space, but over the last almost 15 years, I've served as a fierce advocate for the rare community. So it involves more than 7,000 rare diseases in total. My rare journey began in 2012 while I was working in the emergency room at a downtown hospital here in Atlanta. I started having vague symptoms that really were unexplained. And at the time, I had 15 years of critical care experience under my belt. So I was puzzled, and I went to several clinicians and even traveled out of state for answers. And in total, spent 5 years researching and looking for next steps and any type of resources I could find. And it took more than 5 years to get a diagnosis. And unfortunately, by that time, I had developed heart failure. So that's why I'm on oxygen. And I really became passionate to try and really find resources. And if they didn't exist, try and help lead efforts to create some resources for the rare community. I think what was most striking is if if a nurse with critical care experience and 15 years of bedside experience um, struggled to find answers and get a diagnosis for a rare disease, then how much more difficult would it be for just anyone else? And in my case, I was extremely frustrated because I had 5 years of transplant nursing under my belt. And I think my most devastating day, because I'm a mother, I have two beautiful children, and I was very devastated the day I found out that I wasn't a transplant candidate because of the underlying disease that no one understood. Um, it was indeed a battle because if I Googled or searched anything, I think I found one sentence at the time in 2012. It was said that for my disease, most individuals pass away at 45. Obviously, that's not true. I have surpassed that. However, it really inspired me to find others with my disease, and that led me down the path of connecting to a larger nonprofit, an umbrella, if you will, that had millions of rare patients. I also launched an organization that connected me to over 8,000 individuals with my disease to find out what their disparities were and what were the lacking resources. That then fueled and ignited the fire to write a book and talk about the journey, which then also led me down the path of advocacy, which led to advocating outside the Capitol and trying to raise awareness with lawmakers and about the importance of advocating for families with rare diseases and the impact some of the laws have on those families. And then that also opened the door for more changes, which led to innovation. That's Rare Strides. We're building open source tools to really empower and help patients with rare diseases, and also tools that give back. I'm also involved with Rare Wish, which is all about granting wishes for patients with rare diseases and funding clinical innovation because that is a huge unmet need in the rare space. So I am grateful for my rare journey because it helped to strengthen my understanding about rare diseases, and it also gave me a powerful voice because as a patient and also a nurse, experiencing the disparities firsthand gave me a front row seat and also ignited the passion to do something about it. As I've always joked and said, I may be sick, But there's nothing more powerful than a nurse with a laptop on a mission. So, so here I am, and you know what? I'm still fighting, and I will continue to fight for the families because the hashtag we like to use is make rare visible. You are visible to me, and your journey matters. So I'll keep fighting as long as I can. I think to improve the patient experience, we have to remove some of the paywalls to education and resources. We have to be better than that. We have to put the patient and their medical team in charge of their care. We have to provide these resources to the community for free. Nothing hurts my heart more than seeing a patient pay for a conference about them. They go through enough and their journey is hard. They're struggling to make it from one month to another. They don't need to pay exorbitant fees to attend a conference about ways to help them. We need to allow and open the doors for patients to share their experience at all of these events, because when decision makers, when lawmakers and others don't go down the path of a rare journey, I feel like before they make final decisions on anything that could impact our community, we need to open the doors and let the family share about their experience, because many times that could change the outcome. I love my rare community, and I can tell you there's some exciting things coming down the pike. We're going to make a difference, and we're about to make rare visible in healthcare. So watch out. I'm still I'm still going to advocate, and lots of good things to come.